So I'm Roshun Sankaran. I'm a recent graduate. I graduated in spring 2016. I was a neuroscience major in the College of Literature, Science, and the Arts, and I did a minor in applied statistics. I'm originally from Columbus, Ohio, kind of enemy territory. I was at CHEPS, I guess, three and a half years, starting the summer after my sophomore year. Most recently, I've been on the Surgical Instruments Project, the M-Safety projects, both Project 1 and Project 2, and the BMT Roadmap project with Dr. Choi. Surgical Instruments has been one of my favorite projects. I think it was the first project where I really saw the value of sort of a systems-based approach to solving healthcare problems. I think it was the first project where I sort of saw all the things that go on behind the scenes that, as a science major or a future physician, you don't generally get exposure to that kind of thing. But I think it kind of allowed me to see how changing processes behind the scenes really affects patient outcomes, affects patient safety, affects staff morale, all these different facets and these important factors, and changing the entire system is really important. Conference memories are some of my favorite. My first conference was in Orlando when I was just a junior, I believe, and it was memorable for a couple of reasons. One, I'd never done anything like that before, given a conference presentation. Two, I had some technical difficulties during my presentation that kind of made me think on my feet, and it ended up being okay and ended up being a really good experience. And then most recently, we went to a conference in Orlando this past year that was a lot of fun, both getting to see some really interesting talks, but also just kind of getting a chance to hang out with some of my coworkers outside of CHEPS. My plans are to attend medical school. Originally, I was going to attend starting in fall of 2017, but I recently made the decision to defer to the fall of 2018. So I'm currently trying to decide what I'm going to be doing this next year. I might be at CHEPS again, at least part-time. But I'm also interested in maybe doing some healthcare policy research, which again, I think CHEPS has helped to spark that interest for me as well. So not only giving me exposure to sort of the systems engineering side of healthcare and its applications to healthcare, but also it's definitely sparked some other interests for me. I think CHEPS has helped in a number of different ways for me. Personally, being pre-med, it gave me a very interesting and different perspective on the healthcare system that I think a lot of people don't get to see, especially sort of physicians in training or future physicians, people in healthcare in general. It definitely gave me a lot to talk about on the interview trail when I was interviewing for medical schools. Most of the people I interviewed with were really interested in what I was doing and my work here at CHEPS and sort of the role that industrial engineers can play in general in solving some healthcare issues. I think CHEPS has helped me both in that regard, giving me exposure to systems engineering and its application to healthcare, but also I think it's made me more of a leader. I've gotten some leadership roles in projects. I've learned new skills, had to learn things on the fly. So I think it's made me basically just a better member of a project team, and has definitely given me some practical skills as far as just program management, project management, things like that.